Hello everyone. In this video we are going to discuss proteinuria, which is important topic not only for biochemistry but also for the pathology, medicine and pediatrics. Learning objective for today's video are: first we will see definition of proteinuria, then we will see types and causes of proteinuria, how to detect the proteinuria, and in the end we will see degree of proteinuria. So let's start. So first we will see definition of proteinuria. So when urine shows detectable quantities of protein, that is greater than 150 milligram per day, it is called as a albuminuria. And this albuminuria is the misnomer because albumin seldom found alone. So nowadays the term preferred is the proteinuria. And the proteins which are found in urine in kidney conditions are commonly believed to be plasma proteins that passes through the damaged renal epithelium. And the albumin being the smallest molecule, it passes very easily, globulins followed by, and fibrinogen least readily. So that is the definition of proteinuria. Now we will see types of proteinuria. So proteinuria is classified under two categories. First one is the functional proteinurias and the second one is the organic proteinurias. So first we will see definition and causes of functional proteinurias and then we will see organic proteinurias. So first, functional proteinuria. So functional proteinuria, it occurs due to the conditions which are not related to the diseased or damaged organ. In the functional proteinuria, kidney is functioning properly normal. Kidney is functioning normally, but the blood supply is disturbed to the kidney, which results in the venous stasis and temporary anoxia. And the amount of protein which is excreted in the functional proteinuria is very less, and this condition is temporary. So that is the definition of functional proteinurias. Now we will see causes of functional proteinurias. So first cause is violent exercise. Violent exercise done by military and army personnel, then athletes, which results in the damage to the renal epithelium and which results in the excretion of protein. So that is violent exercise. Second cause is cold bathing. Cold bathing results in the vasoconstriction, which results in the temporary renal anoxia. Third cause is elementary proteinuria, which occurs after heavy protein ingestion. So that is elementary proteinuria. Fourth cause is pregnancy. Pregnancy is very commonly associated with the functional proteinuria, and the cause of excretion of protein in the pregnancy is pressure effect exerted by the gravid uterus on the kidney. Fine. And the fifth cause is orthostatic or postural proteinuria, which occurs in the adolescents which are having age of around 14 to 15 years. And in the orthostatic postural proteinuria, excretion of protein occurs mainly in the upright position. So these are the functional proteinuria, causes of functional proteinurias. Now we will see organic proteinuria. So organic proteinurias, there are many pathological conditions that causes organic proteinurias and which may be classified into three categories. First one is the pre-renal, second one is the renal, and the third one is the post-renal. Fine. So now we will see the pre-renal causes, renal causes, and post-renal causes. So first we will see the pre-renal causes. So first one is the cardiac diseases. Any cardiac diseases, it will have a effect on the blood supply to the kidney, which results in a proteinuria. Second one is any abdominal tumors or mass of fluid in the abdomen which exerts pressure effect on the kidney. Then fever, convulsions, anemias, other blood vessels, other blood diseases or liver diseases. Then cancer, any inflammatory or collagen diseases. In the cancer, collagen diseases and inflammatory condition, there is an increased synthesis of mucoproteins which results in a proteinuria. Now, renal causes. So the renal causes are acute glomerulonephritis, chronic glomerulonephritis, then nephrotic syndrome, nephrosclerosis, tuberculosis of kidney, or carcinoma of kidney. So these are the causes of renal proteinuria. Now we will see post-renal causes. So this post-renal causes, it is called as a false proteinuria, while the pre-renal and the renal causes are termed as a proteinuria because in the post-renal, the proteins do not pass through the kidney. That's why it is called as a false proteinuria. And the causes of post-renal are it may be occurring due to the inflammatory, degenerative, or traumatic lesions of the pelvis of the kidney, ureter, bladder, prostate, or urethra. Bleeding in genitourinary tract, it may also account for the proteinuria. Fine, so that is about the post-renal causes. So that is about the organic proteinuria. Now we will see how you can detect the proteinurias, diagnosis of proteinuria. So first thing is by the urine dipstick, which is very easily available in the OPD. So with the help of urine dipstick, you can detect the proteinuria. Then second test is the sulfosalicylic acid test. The sulfosalic acid test, after adding the sulfosalic acid, if there is a presence of white precipitate, that means there is a presence of protein in the urine. Third test is the 24-hour urine analysis, then protein to creatinine ratio or albumin to creatinine ratio, and the last one is the electrophoresis. So these are the methods by which you can detect the proteinuria. Now we will see degree of proteinuria. So if protein excretion is less than 150 milligram per 24 hours, then it is considered as a normal. And this range can increase up to less than 300 milligram per 24 hours in the pregnancy. Then if the excretion is in between 150 to 500 milligram per 24 hours, then it is considered as a moderate proteinuria. And if the excretion is in between 500 to 3,500 milligram per 24 hours, then it is considered as the severe proteinuria. And if the excretion is greater than 3,500 milligram per 24 hours, then it is considered as a nephrotic range of proteinuria. So that is all about proteinuria. Thank you for watching. Thank you.